How's it going, guys? We have a past level question for Gastro steps 2 and 3. If you're studying for step 1, I'll tell you some high points. Before we get started, please subscribe to my channel. I really appreciate it. Give it a like, really appreciate it. Find me on Instagram, Mehlman_medical, MEHLM_medical. Links down below. For me, Telegram, links to the Telegram group channel down below. And let's start the clip. 48-year-old dude. He has spontaneous bacterial peritonitis, SBP, and we know that because he has abdominal pain plus fever plus cirrhosis with ascites. Now, hear me out. SBP is the answer on USMLE when you have diffuse abdominal pain plus fever in one of the following 3 demographics. Number 1, cirrhosis. Number 2, nephrotic syndrome. Number 3, recent peritoneal dialysis. So the next best step after adjusting airway, breathing, circulation, basic stuff, is you're going to do a paracentesis, which means aspiration of the peritoneal fluid. Don't confuse with pericardiocentesis, completely unrelated, even though they sound similar. So you're going to aspirate the peritoneal fluid. Then, if they ask you what you do next, you're going to do white cell count and differential if listed. If it's not listed, you're going to choose gram staining culture of the fluid. And this is important, and I know this sequence because I've seen it on NBME exam. There's a question where they list both, and the answer is white cell count and differential. The wrong answer, gram stain culture of the fluid. Then there's another question where the correct answer is gram stain culture of the fluid, and they don't list white cell count and differential. So the inference we can make is that the reason white cell count and differential is correct if it's listed is because the way you diagnose SBP is by detecting greater than 250 white cells per microliter via paracentesis. So you diagnose the SBP, then you do gram stain culture of the fluid, okay? And then you give ceftriaxone as the drug. They ask that for the next best step in treatment, okay? It's a general agent that has broad coverage, 3rd generation cephalosporin. Let's just chop out the other answers here. So choice A is CT the abdomen's wrong. That's high yield for pancreatitis on USMLE. So you're going to do a triad of number 1, fluids, number 2, nothing by mouth, which is NPO, bowel rest, and number 3, nasogastric decompression. Then you do a CT of the abdomen to look for degree of fluid collection with pancreatitis. Obviously, you're going to get your amylase lipase first, okay, and then you do a CT. If it's gallstone pancreatitis instead, then you would do ultrasound first, then CT, then ERCP. Point is, wrong fucking answer. Choice B, endoscopic retrograde, cholangiopancreatography, ERCP is wrong. So as I just said, you can do that as part of the sequence for choledocholithiasis, whether it's gallstone pancreatitis or whether the stone is higher up. So if you have choledocholithiasis, which means stone in the biliary tree, okay, cholelithiasis, stone in the gallbladder, don't confuse the two. So if you have cholelithiasis, stone is higher up, you don't have gallstone pancreatitis, they're going to want ultrasound, then ERCP. If you have gallstone pancreatitis, ultrasound, then CT, then ERCP. ERCP is also the answer for cholangitis, which is inflammation of the bile ducts for diagnosis. I've seen that as an answer on NBME. Wrong fucking answer. Choice C, endoscopy is wrong. So upper endoscopy can be done for a myriad of things. Esophageal cancer, high yield. So if you have a patient who has new onset dysphagia with a history of GERD or heavy smoking alcohol, they want immediate endoscopy is the answer to rule out esophageal cancer. Okay, so GERD leads to adenocarcinoma, distal 1/3 of the esophagus, heavy smoking alcohol, big risk factors for squamous cell, the upper 2/3 of the esophagus, but you're going to do upper endoscopy, and if they tell you endoscopy is performed and a stricture is visualized, the next best step is biopsy the stricture. Point is, wrong fucking answer. Choice C, ultrasound's wrong, so abdominal ultrasound, you can do first line for cholelithiasis, stone in the gallbladder, cholecystitis. So if you have cholelithiasis plus fever, we call that cholecystitis. You do ultrasound first. If your ultrasound is negative or equivocal for cholecystitis only, then you can go on to do a HIDUS scan that they like next. Wrong fucking answer.